give it 1 minute for everyone to join. Hi everyone, thank you for joining us today for our virtual dental shadowing session. We want to remind you that in order to get your hours, you'll have to take a short quiz, and as long as you get a 3 out of 5, you will earn your hours. The quiz will be located in our link tree, which is in our Instagram bio. Alright, let's get started. We are very fortunate to have Dr. Helly Shah for today's session. I am handing the mic to you. Feel free to start whenever you want.
Awesome. Okay. Hey everyone, thanks for tuning in. I'm just gonna dive right in, and I'll just be talking a little bit about my path to dentistry. You could see my email address here, and then my Instagram handle below that. Feel free to contact me if you guys have any specific questions, and I'll try my best to answer them. A little bit about my background. I pursued a Bachelor's of Science in Biomedical Engineering from Drexel University. I graduated in 2012. I decided later on in college that I wanted to do dentistry as a career. So I started shadowing the end of my junior year, and I also started doing some research at the oral biology department at UMDNJ. But I realized that there were a lot of prerequisite courses that I still needed to take. So I enrolled in a master's program in biomedical sciences from Rowan University, and I did a 2-year program there. I took the time to really ace all of the prereq courses. I did a lot of DAT preparation. And I also did some research at the perio department at the University of Pennsylvania. I was in Philadelphia at the time, and there were probably like a good 2 years that I spent really, making myself a competitive candidate. I accepted a position at LECOM School of Dental Medicine. I graduated in 2018. During the end of, or I guess not even the end, during my last year of dental school, I realized that I still felt a little bit unprepared to go out into the real world and just start working as a dentist. So I enrolled into a general practice residency program. I matched to New York Presbyterian Brooklyn Methodist Hospital. And despite doing a year there, I still kind of had, I still had some cold feet. I was like scared to kind of go out there, and I decided to stay on for a chief year. So I actually did 4 years of dental school and then 2 years of residency. My typical schedule, this is like an estimate, but I generally work Monday to Thursday. Tuesday, Thursdays, my shorter days. Mondays and Wednesdays are longer. They could be like 10, 11, 12 hours sometimes. And I work 1 to 2 Saturdays per month. I am a general dentist, so I do a little bit of everything, but mostly what I'm doing are fillings, crowns, some root canals, some extractions, and Invisalign. But I will say the most important skill that you can have when you're in dental school is learning how to correctly diagnose and treatment plan. If you don't know what the problem is, and if you can't diagnose it correctly, it doesn't really matter how good you can do a procedure. So that's like super important. I would recommend keeping that in the back of your mind when you're in dental school. Generally, I see about 8 to 12 patients a day. Again, it depends on how long I'm there, how busy it is, all of that. Those are averages. This is just some pros and cons of being a dentist, and I guess more particularly being a general dentist. So I think the pros definitely outweigh the cons. You're building confidence, not only in yourself, but also your patients. You're restoring smiles, you're helping patients eat better, you're getting patients out of pain, you're really doing everything you can to help them out. And I think that's very positive. I always put a question mark next to money because I think there may be some type of misconception that dentists make a lot of money. I think we make about the same as anyone who's undergone a decent amount of postgraduate education like we have. So it's about the same. It's not super lucrative, but you will have a comfortable lifestyle. Some cons, definitely dealing with dental phobia is a major one. Most people don't like to go to the dentist, including me actually. And so you're dealing with that pretty much every single day. If you're working for someone, autonomy issues are definitely there, kind of understanding their beliefs and making sure that you join a practice that has similar beliefs as you. I think that's very important because you want to make sure that you're agreeing with the decisions that are being made for treatments and that you're able to contribute to that decision as well. Some struggles that you may have being an associate starting out could be just understanding the workflow at a practice. Every practice is so different. The supplies, the materials. There's a very big learning curve into transitioning from school to working at an office. You may be using things that you've never really used before because that's all they have. So those are cons. But again, like I said, I think the pros do outweigh the cons. This is just a little tidbit. I remember dentistry was always in the back of my mind growing up because they were always ranked like number 1 or 2 at the USA News best jobs rankings. And I feel like 2021 was the first time that they weren't really the top. And, you know, they still ended up being number 5. But I remember they were always like either first or second place in the 100 best jobs. So I think a lot of that has to do with the pandemic. A lot of it has to do with COVID and all of that. So we'll see, I guess, next year if dentistry bounces back to number 1 or number 2. That would be really nice. I decided to be a general dentist because you can pretty much do as much or as little as you want. You could do a little bit of everything, or you can do whatever you're personally comfortable with and refer anything else out to a specialist. I think it makes it easy, but it could also make it hard if you're trying to do everything. But I really like it because I feel like no 2 days are ever the same. You're always doing different procedures. It adds a lot of excitement into your day. Another good thing about that is you can refer, like I was saying, difficult cases, and you can also refer when the patient's expectations are too high. So if they really want a specific type of result and you feel like you're not going to be able to deliver and make them happy, it gives you the opportunity to refer that patient out. Dentistry has really become the forefront technologically. I'm just going to go over a couple of things here on the pictures. The top right photo is a digital X-ray sensor, and the screen is showing X-ray films. And basically, you can take an X-ray and see the tooth like right away. And that was not possible long ago. You know, they had films and they had to develop the films, and there was a waiting period with being able to see the X-ray. But now you can just take the picture, show them on a computer, label things, mark things. It's such a good educational tool. One step above that even is the photo on the bottom right, where you see an intraoral camera. It's basically a wand that goes into the mouth and just takes pictures of whatever you want to take. Again, it's very good for educational purposes to show patients exactly what you're talking about. Sometimes they may not understand it even if you're doing a really good job explaining something, but if you just show them one picture, it's so much easier. It also helps significantly with insurance and explaining why someone may need something. You take that picture and you send it to them, and then insurance can understand why you're requesting a certain type of treatment. The bottom left photo is the left side is a CEREC scanner and the right side is a milling unit. So we've kind of gotten to the point where we can do one visit dentistry. You take the scanner and, for example, if someone is coming into your office to get a crown, you can prepare the crown, you can scan them, and then you can mill the crown in your office, and the patient is back home within an hour and a half to 2 hours with a permanent crown. So it eliminates that whole putting a patient in a temporary crown, having them come back, and patients really do like that. I will say that it does have a very steep learning curve, and I really hope that more dental schools now are incorporating such types of technologies. So the transition is much more smoother, because I think a lot of offices now are kind of going into this route. And that's another really good question that you can ask if you interview at a dental school. You can ask them what kind of digital technology that they're having, and what you can expect experience-wise. I think that's a good question. I always get asked questions about corporate dentistry and whether I support it or don't support it, or if I think it's legit or not. I don't really have too big of an opinion on it. I do have some facts just from some of my friends who work there. Basically what it is, it's just large corporations taking over practices. They control all the administrative aspects. So you walk in and you just do the dentistry. You don't worry about scheduling. You don't worry about making sure that insurance is paying. You don't have to really focus on anything at all besides just coming in and basically doing your job. It's usually not run by dentists, and it could be like a large group practice where you may have all the specialists under one roof. So the patient just has to stay at like one spot for any type of treatment needs that they might have. Although I will tell you that a lot of states have actually incorporated corporate dentistry. And I think Florida is definitely a huge example. I went to dental school in Florida, and I must have had many presentations by different corporations who are looking to recruit new graduates to work for them. And I think the biggest reason why people may decide to work for one is definitely student debt. The average dental student will be in probably a little more than $250,000 in debt by the time they graduate. And what corporate dentistry allows is they give you benefits, they give you a set schedule. They generally will pay a little bit better than private practices will. And another thing is also that insurance reimbursements are declining, and a lot of people just don't want to deal with those daily headaches. Many will just be like, I went to school to be a dentist. Like, I don't want to deal with anything else. So it could be a very good opportunity for a lot of people. Some things that I wish that someone told me before I applied, definitely would recommend shadowing a dentist who can mentor you. I think the best way to learn is to just be like right there and assist, suction, do like whatever they'll allow you to do, so that you can be really close to the treatment that's being done, so you can really get a good idea of what's going on. Once you decide to pursue dentistry, just don't give up. You want to apply with the full package. You shouldn't go in with the mentality that you'll just go wherever you get accepted. You want to have multiple options for yourself so that you're happy, because it is a big commitment. It's 4 years, and you want to make sure that it caters to what you're looking for out of your education. You want to do it for the right reasons. Again, it's not like a sole, just a financial type of thing, because like I was saying about the student debt, like it is, you will be in a decent amount of debt. You do need to understand that it's a lifelong commitment. You will be taking continuing education courses pretty much for the rest of your life. That's really the only way that you'll be marketable to your patients, because you want to always be at the forefront and you want to make sure that you're doing things the way that everyone else is doing them. So that's super important. Of course, apply early. I know that's probably like the number one advice that anyone will ever give you guys. And I honestly don't think I applied until October or November. So I think I may have had more options if I did. So I do recommend that. And have some mentors a few years ahead of you who can guide you, who can help you, who can answer questions. You'll have, great friends in dental school, but if you have mentors who are ahead of you, they're not necessarily really competing with you. So I think you'll get very good advice by doing so. Now I'm just going to go over some of my some case studies. I did all of these cases while I was in residency. That's why I have a lot of documentation, a lot of photographs. And so I'll just dive into that. So this is my patient EC, or her initials, 60-year-old female. She lost her middle left tooth and the tooth to the left of that in an accident. She could only afford to fix her top front teeth. That was her major thing. She had financial issues and she was like, I only want to fix that. And we said, no problem. So what I fabricated for her was a porcelain fused to metal bridge. A bridge can be used, it's a fixed option that doesn't come out of your mouth, and it can be used to replace one or multiple teeth in your mouth. And this model that we have on the bottom left, they're just my crown preparations, and you can see the space here, that's where she was missing teeth. And the bridge was to go from here all the way to here. So it's 6 units. This top right photo, that's her and her temporaries. That's what she started out with. That's what her teeth look like before we did anything. And then the bottom is the final product. It is her bridge from here to here. She was very happy with it. This would definitely look a little bit more aesthetic if her bottom teeth, which are kind of flared out, if she did some orthodontics or Invisalign or something and push the teeth in, I think it would have looked even better. But again, you have to meet patients with their expectations, and you have to kind of do what they can afford. And I think she was still very, very happy with it. This is the same patient. She also lost teeth posterior to her bottom right canine. And for this, she had a implant supported bridge done. And I'm just going to explain the pictures in a little bit detail here. So you can see here, these 3 are where she had the implants placed. These little screws on the top are called healing abutments. They help contour the gums so that when you have your bridge in place, the emergence of your gums look more natural and you don't see like metal, or it doesn't look like, you have a prosthetic in your mouth. So she had these healing abutments on. The second picture here is what we call a verification jig. What that is, it's an appliance that is sent from your lab, and after you take an impression for the bridge, you can ask for this to make sure that your impression matches exactly the position of the implants in the patient's mouth. So we just placed it, we screwed it in, we took an x-ray, and we confirmed that this is correct placement, and then we were ready to have the final bridge. This is the bridge over here. These little holes on the top, this was a screw retained bridge, and you just place it in, and then you just take an instrument and you tighten it like a screwdriver. And unfortunately, I don't have a picture. I did end up delivering it to her. I just don't have a picture of what it looked like in her mouth. this was another very interesting case. This guy, he had trauma at work to his two front teeth. He actually ended up losing the front right tooth, and he wanted what we call like a bridge, like I was explaining. The problem is that this space is so large, and he had what we call a diastema in between the two front teeth, and that's basically just a natural space. But with the bridge, there's no way to keep that space, and this tooth over here and this tooth over here were very, very narrow. So we had to understand the patient's expectations for this. He ended up fracturing this tooth, and that's the reason he had to get it extracted. So what we did is we did a diagnostic mock-up, and what that is you take an impression of the patient's top teeth, and then you pour it up and you have a stone model of what this looks like. And then you can play around with wax and try to make this tooth bigger, and then this tooth over here bigger, and try to make the teeth all a little bit bigger so this space isn't as big. And I actually did work on this with some of my co-residents and attendings, and it was like a really, really cool learning experience. Once we waxed up all the teeth, I took another impression, poured it up into a model, and then created like a putty stent. I used that stent to place temporary material inside of it, and then I put it over this patient's teeth. So this is just, none of the teeth have not been shaved away, nothing at all. This is basically just a temporary material of this mock-up that we created. And this kind of shows the patient what his teeth could look like. And this is the time when you ask the patient if they're happy with this and if they're okay with something like this. And he was very happy if his teeth look like this. So we removed this, obviously, and then we had to cut the teeth away for the bridge going from here to here. Unfortunately, I didn't get a chance to finish this case because of COVID, but this mock-up learning experience was really, really good. And I think it's a really good tool that you can have in your pocket, because most labs will do the mock-up for you, but if you have a patient who can't afford a lab mock-up or anything super professional, even if you do something by hand really quickly, I think they would really appreciate it. And this helps us understand that the patient will be happy with the result. So this is just a little a quote by Marilyn Monroe that I really like. The sky is not the limit, your mind is. And I think that's kind of how I look at general dentistry. I really feel like you could do so much, you could do so little, you could do whatever makes you happy. And these are just some pictures that I captured while I was in residency of some things that I enjoyed doing. The top left photo is the first tooth extraction and bone graft that I ever did. The top right is another bone graft. The bottom right is a tooth extraction. And then you could see the wisdom tooth popping up from the socket, which I thought was cool. And then this is just a root canal. So, I mean, again, you could do as much or as little as you'd like. I'm just going to go over this final case. I had a patient who had periodontally involved teeth numbers 14 and 15. Those are your upper left back molars. So it would be these two teeth here. They were very loose and just not healthy. She really wanted implants, but we saw that her sinuses were really, really low. Like they were very close to that. So we could not place an implant after extracting the teeth. So this was after the extraction of the upper left molars, and we let her know that she's going to need a sinus lift, because sinus it's like dead space. You can't like place an implant into the air, essentially. So that's why she agreed to do it. And this video over here is just of a video of the actual sinus lift. So this over here is her sinus, and she's breathing in and out. And you can see here, I did not do this. I assisted a very talented oral surgeon, but I thought it was really, really cool to see. And the sinus was lifted and bone was packed into the space. And then she had to heal for 6 months before she'd be ready for implant placement. But super cool experience. You'd be surprised at how much you'll learn just by assisting other doctors. All right, so that's pretty much it. I kept it pretty casual, pretty general, and I'm willing to answer any questions that you guys might have.
Thank you so much. This was very informative. We have a couple questions. One starting with, how do you find jobs once you graduate? Are there any red flags to look out for when you are looking for offers?
I think it's like applying for a job is the same as applying for anything. You kind of want to get a good idea of what you're looking for yourself, make a list of those things, and then just interview. You can go on Indeed. Any normal job posting website will have jobs for dentists, and you want to interview, and you want to make sure that everyone's on the same page, and you want to make sure that your personal boxes are checked off. It's not going to be everything. You will have to compromise on certain things, but the closer you can get to it, the better. And I would say don't take the first job opportunity that you get. You kind of want to interview around and see what's out there, and then make your decision from there.
Thank you. Someone asked, I really like LECOM as a potential school to apply to, but I am having trouble finding a ton of information about it. Can you explain a little bit about the clinical experience and how often exams are given?
Absolutely. I can tell you how my experience was in general. We had problem-based learning, and that basically is we didn't have many lectures for basic sciences. So a lot of what we did was gather in groups of 10 and do case studies, but we had to do a lot of studying and reading on our own. For me, that was super easy because I did the biomedical sciences master's program. Some people really loved it. Some people didn't like it. They wanted something a little bit more structured. So just know that that is definitely more of like a self-study type of thing. The same goes for some of the pharmacology courses and a lot of the more advanced science courses, I would say. You do get a fair amount of clinical experience. Third year, you're in clinic pretty much all day from 8 to 4, every single day, Monday through Friday. And your fourth year, again, you're in clinic. The first 3 years are in Bradenton, Florida. And your last year, you actually split up into, so the class size when I was there was 100. 50 went to Defuniak Springs, which is in the Panhandle, to work at a outreach clinic. And the other 50 went to Erie, Pennsylvania to work at another outreach clinic. And there you're pretty much just doing dentistry for 6-7 hours a day. You're just being a dentist, and you're getting a lot of practice. As far as frequency of exams go, I think the frequency is about the same as it would be for any course. You still have semesters, you still have I'd say probably between 2 and 4 exams per course, just depending on what it is.
Perfect. Another question is, aside from the learning curve, are there any downsides to CERC?
I would say the major downside is that when you do a CEREC crown, you're designing it yourself. So if you design it incorrectly and the crown doesn't fit, you just wasted 1.5 hours to 2 hours, and you're going to have to redo it. And you may not have the space in your practice or the time to redo it. So I think that's probably the biggest downside. So you definitely want to make sure that you at least take some courses on it, or you work at a practice that's willing to really help you understand the technology.
Perfect. Someone asked for the third case, how could you tell that the sinus was really close? How does the sinus lift work?
Oh, that's a good one. I'm sorry I did not show any x-rays, but usually on an x-ray you'll see the sinus is kind of, it curves like up like this. And you want to look on the upper arch in the posterior region, like where the molar teeth would be. And if the sinus is low, you'll see like a curve that goes really close to the teeth and goes up. Some people's, it doesn't go down as low and they're fine. But a lot of patients will have like a very low like sinus. And it's seen on an x-ray.
Perfect. Someone said, do you know some of the downsides to corporate dentistry? Whenever I talk to my dentist, it seems to be pretty demonized among private practice owners.
I mean, I did kind of go over that a little bit. It's very, you kind of lose that like small family practice feel with corporate, because corporate's like a business, you know? So I think when you have, people who are not dentists attempting to treatment plan for you, that could be a red flag. And there are some corporates that do that, so that's something you want to look out for. You want to make sure that you're the doctor who's going to be diagnosing and treatment planning things. So another thing is, I think they're a little bit, I mean, honestly, like dentistry, a dental office is a business at the end of the day, whether it's a private office or whether it's a corporation. There's just an overhead that you're going to have every single day, no matter what. So you want to make sure that you're able to produce. And some people may say that corporate dentistry is more production oriented. I have no idea, because where I like work and a lot of my colleagues work, it's pretty production oriented everywhere. So I don't really know. But I would say that the one red flag is not being able to treatment plan according to what you would like.
Perfect. Another question is, how does the match system work for dental school?
It works pretty much like how medical works. You apply through match to programs. You can visit them beforehand if you'd like. You apply, and then you are given interviews depending on your application, and you rank. And if they rank you and you rank and you match, you get matched. It's the same thing as medical.
Perfect. Another question is, would you say that the work of a dentist on a daily basis is very strenuous compared to other fields?
It really depends on, there's so many other fields. It does take a toll on you physically, I think. Probably a little bit emotionally as well, but I would say like I'm on my feet most of the day, no matter how long or short my day is. It is a lot of posture, keeping your posture straight, and it's a lot of working your neck and your shoulders and your wrist and all of that. So I think self-care is very important.
Another question is, how do you make the composite look like a real tooth? What is the trick?
Composite. I practice. I think when I first started doing composites in dental school, they were very flat. The more you see teeth, your hands just glide with the anatomy, and you just mentally, you just know like what the tooth is supposed to look like. So I think practice makes perfect. In dental school, you're going to be doing a lot of waxing up before you start doing anything, where you basically are taking wax and you're making teeth with a carving instrument. So you're going to get a lot of practice with that. And the only way I could tell you is just practice.
Perfect. Someone said, I have a 3.9 GPA, but was involved in an academic dishonesty situation. I was wondering how that would affect my application and what I can do to improve it.
I honestly don't know. I think if I were in that situation, I think it's important to just be honest and figure out exactly why that happened, and make sure that it never happens again. And I don't know if it's something that gets reported when you apply for dental school. And if you do, if it is something that gets reported, it may be something that you want to not bring so much attention to, but also have a very good explanation if it's brought up during an interview.
Perfect. Someone said, what are some of your favorite, most favorite and least favorite procedures to do?
I like fillings and crowns to a certain extent. I like easy extractions and straightforward root canals. I think I would say maxillary molar root canals are my least favorite. They're the molars that you have all the way in the back. They have like really funky anatomy, and endodontists who are the specialists with that, they do such a good job. They have microscopes, they have amazing instruments. So I think that's definitely my least favorite thing to do. I honestly don't do much of it.
Okay, last few questions. Someone asked, what was your most fun memory from dental school? What was the most challenging thing about dental school?
The funnest part of dental school was making good friends and just having a network of people to rely on. I was in Florida for my first 3 years, so I really tried to make use of the beautiful weather, and just hanging out with my friends. I really enjoyed the company a lot, and it's probably one of the last times that you're ever going to be surrounded with people who are similar in age to you. So definitely make the most out of that. I think the most challenging part of dental school, like any school, is learning how to manage your time. And dentistry is like hands-on and didactic, so you have to make sure that you're not only studying for your test, but you're also practicing on your free time, because you have practical exams and you have written exams. So balancing that really well so you're performing good is important.
Perfect. Someone asked, how much did you study weekly in dental school?
I did study every single day, I would say. Again, I had the problem-based learning curriculum, so a lot of my academics was self-study. I didn't have many lectures. So I think per exam, we may have had about 8 to 10 chapters that we had to know inside and out. So I created a study plan for myself, and I made sure that I stuck to it.
Perfect. Someone asked, I know loops are important, but I wear glasses, so what should I look for in loops when looking at different brands? How would loops plus glasses work?
So I wear glasses too, and I have inserts in my loops that actually have lenses inside with my prescription. So I wear them, and most places they can incorporate your prescription into it. Just know if your prescription changes, then you may need a new pair of loops, and they're not very cheap. So just keep that in mind.
Perfect. And last question is, was it a bit stressful to study for the board since there's a lack of structure in the curriculum?
Not really, because boards also don't really have structure. It's also studying from textbooks, and it's very similar as problem-based learning was for me. A lot of my test exams had questions from previous boards, so I think it was actually very beneficial for me.
Perfect. I just want to thank you for joining us for today for today's session. We learned a lot about general dentistry and what you do. So thank you for joining us. And just to everyone, make sure to take the quiz in order to get your hours. Thank you for joining.
No problem.